If you're just now tuning in to Casey Close-Up, good morning. I'm your host, Donna. And so now we're going to transition over and talk about Women's Health Month, which is in May. And this is the last Sunday in May. So we're definitely going to talk about this. And to join us and talk about this, we're going back to Dr. Jim Mirabile, who is with Mirabile M.D, Beauty, Health, and Wellness, and who is also with the Health and Wellmobile. Good morning, doctor. How are you?
Good morning, Donna. Thank you for having us. How are you doing?
I'm good. A little tired, but good.
That's okay. Well, you mentioned May as being Women's Health Month. And, as a practicing gynecologist, every month, every day is Women's Health Month for us here at our practice. And so it's not just one month in particular where we try to, provide people with the best of care possible, being well-rounded, giving total wellness and health care to women. So, our office, Mirabile M.D. Beauty, Health, and Wellness, is basically a one-stop shop for total wellness. And I don't want to discredit other parts of the practice. We do women's health, but we also do a lot of men's health with regards to bioidentical hormone replacement therapy, utilizing testosterone for the guys, and kind of started where I just started doing the hormone therapy for women, but it was amazing how responsive women are to natural hormone therapy that they started bringing in their husbands and going, hey, will you take a look at this for my husband? Will you take a look at that? And that's when we incorporated bringing men into the practice. And, we have the gynecology division, bioidentical hormones, and Medi Weight Loss, which is a nationally known weight loss program. We are here in Kansas City now for over 5 years, and we are up to almost 35,000 pounds that we have lost for the Kansas City community. And also Med Cosmetic, which is our medical spa, the oldest medical spa in the greater Kansas City area, going on 16 years and practicing for both men and women again, non-invasive cosmetics with hair removal, vein removal, fillers, Botox, Dysport, basically all types of laser treatments for men and women. So basically, it's a one-stop shop, and I've got a terrific team of 24 women here that I get to go to work with every day, and each one of them is just as passionate about what they do as I am. And everybody is overachieving goals that we set and trying to just treat our patients the way we want to be treated.
And then going back to that hormone replacement therapy you were mentioning, for women in general, is that just something that needs to be looked at around the menopause phase for women, or is there any time of phase in a woman's life that could use some hormone replacement therapy?
Donna, we see women from their 20s all the way up until their 80s because hormones don't really pick a certain time of life when they can be less productive in the body. It's amazing how we can take a 35-year-old woman that comes in with, issues that most doctors would treat as maybe depression or anxiety and healthcare problems like that and head in that direction. And it's simply, replenishing some natural hormones that their body is deficient in. So no, we don't wait for menopause to start treating people. If we can catch women, in their late 30s and 40s, we can bypass that whole difficult, what we call perimenopause, that 40 to 50 where women are getting tired, they're fatigued, their hormones aren't functioning right, they have decreased libido, facing, relationship issues, weight gain, because when your hormones aren't balanced, I don't care what diet you go on, you're not going to be able to lose adequate weight without having your hormones balanced.
Well, and I know my mother for sure, when she went through menopause, she gained roughly around 20 to 30 pounds out of nowhere. She was so frustrated. And so her and I got it together, started exercising and eating right, and she wouldn't lose weight. I was losing weight, but she wasn't. And she was so frustrated. Maybe I should have had her go and visit you.
Well, we're a different generation today. We're treating a generation of women that used to be if you turned 50 and you went through the change, you just got old. The baby boomers are now the patients we're treating in menopause, and it's a generation that wants to look good and feel good. They're at the prime of their life now. They're not ready to give up, and, you have to be able to function. That clear-headed feeling that you need, whether whether you're dealing with family issues or work issues, it really gets bothersome for women when they walk into a room and they forget why they walked into that room.
Mm-hmm.
And that's a hormonal issue that can be addressed and treated naturally without using medications that can cause side effects or permanent problems. But it's this generation we're dealing with now that really, our parents got old. When they turned 50, they got old. This generation is just getting started for some women. And, this all needs to be looked at in a way that we don't make people feel bad about what's happening or make them feel like, here's an antidepressant, because that's the worst thing you can give somebody when they're going through this is an antidepressant, because they're going to gain weight and they're going to suffer with less libido, which are the two reasons why they're there in the first place. So, we get people off all of the antidepressants and anti-anxieties they're on and get them on a regimen with natural hormone therapy, and it works. And we've got thousands and thousands of women to give a testimony about that.
And then how about for women in the hormone replacement therapy that might not be able to take estrogen?
Well, first off, I would ask your doctor that, do I still have my ovaries? If you still have your ovaries and you're making estrogen, you're exposed to hormones. So, when people say, oh, you can't take hormones, well, you're still making hormone right now at numbers and levels that, are way beyond what we give people. So unless you have a medical problem that they take out the ovaries and say, you can never have exposure to hormone therapy, then these are people that we deal with every day because we're not giving them a synthetic estrogen. We're giving them a natural estrogen that is identical in composition molecularly as the hormones that you're making. So we're not putting you at any increased risk. We're just continuing on what you were doing on your own anyways. So, doctors and people fear the word estrogen. However, it's not only estrogen that is the big culprit when we talk about, menopausal complaints or libido issues. When you felt good, when you're in your late 20s and, everything is great, and you have a libido and have a thin waist and no fatty tissue, that hormone responsible for that is testosterone. You think testosterone is a male hormone. Well, basically, we have estrogen for women and testosterone for men. Women make testosterone, men make estrogen. Obviously, we make different amounts, but we replenish the testosterone in women, and they do phenomenal. We have breast cancer patients that cannot be exposed to any estrogen, and we give them testosterone, and they do fantastic. However, the American College of OBGYN just 4 weeks ago came out with a statement that even women with breast cancer can now be given estrogen therapy for problems with dryness and painful intercourse, things like that. So everybody's becoming a little bit more liberal now because we're dealing with a different generation of women that we have to be that way.
Definitely remember that when I go through the change. And so you also do a wide variety of treatments for other health issues for women. Can we discuss more about that?
Sure. With regards to Women's Health Month, we do have, for both men and women, our medical spa. We have excellent practitioners there. We have estheticians. We have registered nurses, physician assistants. We have people there that are just truly dedicated to making people look good at the same time while they feel good. Whether a patient's here to discuss hormone therapy or get laser hair removal or they need to lose 20 pounds, everybody here on staff is committed to making that experience a positive one. So, with the cosmetic side, we do Botox, we do Dysport. Those are both neurotoxins to decrease wrinkles. We do skin rejuvenation procedures. We've got a great treatment which is called a skin pen, which actually is a little bit thicker than a pen that you write with, but it has micro needles at the tip of it, and we make little indentions into the skin, and what that does is it stimulates collagen. Collagen then builds up behind that, and we can take away fine lines, some wrinkles, acne scarring, things like that. We do vein treatments. We do hydrofacial, which is a really intense facial. If you've ever had a facial, they rub and they poo and they smooth stuff all over you. This is actually like a vacuum that actually sucks the tissue and pulls all of the debris and oils out of your skin, and you actually see that going through the tubing. And these are not expensive procedures. These are procedures that are cost effective because in the long run, if you take care of your skin when you're younger, you're going to benefit as you age. On the other side of the practice, we have Medi Weight Loss, which is a national medical weight loss program. I think nationally they're at over almost 3 million pounds. Here locally, we're at 35,000 plus. They're not numbers we can play with. You get on a scale and it's all electronic and goes into the computer. So, it's basically a lot of counseling, changing people's dietary habits. It's a lifestyle change. I've got a dedicated staff that they enjoy doing that for people. They work with them. And the reason why we combined it all together, like we talked earlier about the hormone therapy, women will come in, they'll get on the plan, and then they'll get stuck. Well, they're going to get frustrated and they're not going to continue on, or they're going to gain the weight back. That's when the girls start talking about the other parts of the practice, like, let's look at your hormones. Let's see what we need to do to tune that up so that we can make you more successful in your weight loss endeavors. And at the same time, you feel better about yourself and everything else comes together for them. But, the entire staff from the front desk, it's a place that I actually enjoy going to work at every day, and we call it work, but it's a fun environment, and I've never had such a dedicated group of women working with me every day. And we've got people here from some recent new people we've hired on as we expand to my nurses, or over 20 years, one of my nurse practitioners. It's a well-dedicated staff that wants to look, feel people, make them all look good.
Also, I see that you can do some endometriosis treatments.
Yes, we treat endometriosis, we treat abnormal uterine bleeding. Endometriosis is a horrific problem for women with chronic pelvic pain and starts limiting them and taking away from their daily activities because of chronic pain. And this starts, we see this in young girls. We see them starting to miss 2 or 3 days of school every month during their cycle, and it can be really devastating with them in the long run. But, there's treatment options for that. We have to diagnose it first. There's surgical options and medical options treating endometriosis. One of my favorite procedures is treating abnormal uterine bleeding with a 120-second procedure that stops your periods. For a woman, after they're finished with kids, you have to be done with childbearing, but it takes, 2 minutes if you're a candidate, 120 seconds to stop your periods completely. And, people don't have to undergo major surgeries anymore with 6 weeks off for a hysterectomy because an ablation can take care of that. And those are procedures we can even do in the office now. So those are 2 issues that we deal with daily on the gynecology side of the practice. And while I'm talking about that, I just want to say a few words to my nurse practitioners. I've got 3 wonderful nurse practitioners that have been here anywhere from 5 years to 20 years, and total dedication to women's health. I support what they do. They help every day in the office, seeing patients, taking care of patients. They have their own clientele. They'll call me if they need something from a physician point of view or if they have a surgical issue. But they are well-qualified and dedicated individuals. And I couldn't say enough about Bridget and Betsy and Sandy, who see a lot of patients. And really, I talk all the time about going to the mall one year at Christmas, and a woman came up. I went to buy something, and I gave her a credit card, and she goes, "Oh, you're my doctor." And I said, "Oh, I'm sorry. I don't remember everybody I see." Mm-hmm. And she goes, "Oh, I don't see you. I see Bridget." And it's like Bridget's got her own little gig on the other side of the office here taking care of women. But they're outstanding practitioners and do, basically the same things I do other than surgery.
Basically, all of you are just changing lives and giving people their lives back here in Kansas City. And we couldn't thank you enough for that. And that's also why you joined with the Health and Well Mobile. And coming up with the Health and Well Mobile, you can always find them out here in Kansas City at local events. And if you want to see what's coming up with the Health and Well Mobile, and if Mirabile M.D. is going to be with them, you can always go to healthwellmobile.com, and that's healthwellmobile, MOBILE.com. And you also give out coupons for the Medi Weight Loss and Med Cosmetic, and you do the body composition analysis as well.
Right. We're really excited to be part of the Well Mobile this year. People can, go to any event that the Well Mobile is at and get information in regards to all parts of our practice. And we did bring on a Tanita scale, which actually shows participants that they go to the Well Mobile a body analysis, a body composition composition analysis, where we look at the distribution of your body weight expressed as a ratio of lean body mass to fat mass. And it's kind of a tool just to maybe stimulate you to realize, hey, these are things that I can work on. And we give complimentary consultations. It's a free visit to come in and talk about the plan and go over what we can do. But we're really pushing that through the Wellmobile right now.
And if anybody wants any more information about Mirabile M.D., you can always visit their website, mirabilemd.com, and that's spelled MirabileMD.com. Or you can also call them at 913-888-7546. Again, that number is 913-888-7546. Now, Dr. Jim, is there anything else you want to discuss this morning that we haven't already?
Go to the Wellmobile events, and we have coupons there also. We look forward to seeing you at the office and do what we can to make you feel and look good.
I hope you enjoy your Memorial Day weekend. That is pretty much all the time we have for Casey Close-Up. Thank you so much for tuning in this morning, and have a great day. We'll be back